Hello everyone, my name is Lila Ford and this is my capstone project on integration of big data analytics into personalized medicine strategies. This is for HAP 790, the Capstone Practicum in Health Informatics. So for my capstone, I did the evidence-based research project, and my objectives for my project as well as the objectives for this presentation were to perform a literature review that highlights the current challenges and opportunities of applying big data analytics to personalized medicine, analyze some of the ethical challenges related to personalized medicine in the context of the health belief model, and organize an implementation plan in clinical settings to adopt personalized medicine strategies. First, it's important to understand what is personalized medicine, and it really allows for a shift away from traditional one-size-fits-all approach to healthcare, and instead it takes into consideration a person's unique genetic, environmental, and clinical factors. And the goal of personalized medicine is to ensure that the patient is getting treatment that will work best for them and minimize adverse effects, allowing for better patient care. And also allowing providers to focus on providing preventative and predictive care rather than reactive measures. So one field where this is largely becoming seen is in oncology, and it's used for cancer treatments where they look at genetic testing and a patient's specific medical history and kind of target the therapy based on that data. And the reason that big data is related to personalized medicine is because of the rapidly expanding amount of healthcare data that is being developed. A key contributor in personalized medicine is genomic data, and that itself has rapidly expanded over recent years. According to the National Human Genome Research Institute, it is predicted that genomics research will generate somewhere between 20 and 40 exabytes of data within the next decade. And so in order to be able to keep up with the large amounts of data, I feel like it will present some challenges that applying big data analytics techniques will assist in helping further advance the capabilities of personalized medicine. So for my project, I did a literature review that consisted of 8 articles, and 5 of them I found to be mostly relevant to the topic. Overall, I definitely found a lack of studies on the use of data analytics for personalized medicine, and a lot of the articles that I found were more loosely associated, talking about personalized medicine as a whole or related to oncology treatment and how personalized medicine is used in this area. Overall, the low number of articles available indicates a need for further research to fully understand how data analytics can be utilized for personalized medicine. I was able to identify 2 challenges, data integration and data security. Looking at data integration, there's a lot of different data types that are used for personalized medicine. There's genomics data, there's electronic health record data, which in itself can have a lot of different data types. There's structured data like assessments and lab values. There's less structured data like physician notes, and all of that can be important to consider and look at in order to get a better picture of the patient. There's also patient-generated health data, which can include implanted devices like pacemakers, and so it can be difficult to handle all of these large amounts of data and be able to extract meaningful information and conclusions in order to get a picture of the patient as a whole and what their needs are in related to personalized medicine. So data security is another big issue because in order to be able to apply analytic strategies like machine learning methods to personalized medicine, it's important to utilize real-world data. And although large amounts of healthcare data exist, it is often difficult to find the proper channels and permissions to use the data. In many cases, it has to be de-identified before it's used, and if it's not done correctly, there is a risk of re-identification. And because of these fears, some organizations choose not to share their healthcare data at all. And then there's also the issue, I found that some countries have different rules regarding confidentiality related to genetic testing. Genetics, since they have a strong familial relationship, some countries believe that genetic testing results should be shared with other family members who could be at risk. And this ultimately can lead to a sense of distrust in the system and a reason why patients may choose not to undergo the testing, and this can cause them to miss out on the benefits of targeted therapy. Focuses on ethical concerns related to the adoption of personalized medicine strategies. And I found that this was easier to understand in the context of the health belief model. This model was developed in the 1950s by the United States Public Health Service, and it explores how and why people choose to participate in health prevention measures. It has 4 key components: perceived benefits, barriers, susceptibility, and severity. So the idea of perceived benefits is that a person will be more likely to participate in a health behavior if they positively perceive the benefits of the behavior. In the research, I found that a majority of health professionals have a positive attitude toward personalized medicine, but they also express concerns regarding the value of genetic testing and whether their patients would truly benefit from it. They are concerned that patients may not be able to understand what personalized medicine is, either related to a low health literacy or because of specific ideas that relate to personalized medicine. And some providers were also concerned that they themselves do not adequately understand personalized medicine to practice it. Looking at perceived barriers, that is the idea that people are more likely to engage in health behaviors that they view as having a low number of obstacles, or that the obstacles are not difficult to overcome. Personalized medicine has a lot of testing, genetic counseling, and even trialing of different medications. It can quickly become very costly if patients have to pay for it out of pocket or it's not covered by their health insurance. And this can be further exacerbated by the limited number of facilities that currently offer personalized medicine approaches. And both of these can potentially lead to unfair access and contribute to existing healthcare disparities, especially in minority populations. People may not even be aware of personalized medicine to request it as part of their care. So all of these can kind of act as barriers. And then finally, the perceived susceptibility and the perceived severity kind of go together. The perceived susceptibility is the idea that somebody is more likely to engage in a health prevention behavior if they deem themselves more susceptible to the condition that is preventing. And the severity is the idea that somebody is more likely to engage in a health prevention behavior if they feel the condition of not doing so is severe and will have a big impact on their lives. So for the ethical concerns related to this, I think it's related to the potential for psychological harm. Some genetic testing, besides just oncology, some genetic disorders don't have a cure, such as Huntington's disease, and some patients may prefer not to know if they have a disorder like this since nothing can be done to stop it, but some patients may still prefer to know anyway. And even if the testing is negative, there is still a level of psychological harm associated with waiting for test results to come back. And there are even instances where tests are inconclusive. There have been times where patients have gone and gotten preventative surgery for cancers, even though their test results were inconclusive, which ultimately has the potential to lead to unnecessary medical procedures that can end up causing more harm than good. So that's why overall it's important to consider each patient's specific circumstances before deciding whether or not personalized medicine is a good approach for them. Last part of my literature review looks at opportunities for addressing some of the challenges to personalized medicine through the use of new technologies and big data analytics. I found a number of encryption types. Advancements in technology have brought about different kinds of encryption to help ensure the safety of data. 2 of them that I found were blockchain-based cryptographic technique and homomorphic encryption. And overall, the different types of encryption that's available is definitely promising for the security of healthcare data and preventing re-identification. Cloud computing can address some of the physical capacity concerns to store the increasing amounts of healthcare data. It is good for reproducibility, and it allows access to resources on demand and has many options that help limit security threats as well. And then finally, machine learning can be utilized to perform predictive analytics, which is one of the key elements of personalized medicine. And there's many different types of machine learning methods, and ultimately which one will be used would depend on the goal of the analysis, but the many different types are beneficial to allow for adaptability. Despite its challenges, the opportunities I feel are great enough that healthcare clinics and hospitals should adopt personalized medicine strategies to help improve patient care and reduce costs. There's a wealth of data available in electronic health records that contain treatment history, medical history, demographic information, and more, and it can be very difficult for the human mind to piece together all the information and extract meaningful relationships. However, computers, especially the use of models such as machine learning, can help detect patterns, keep data organized, evaluate outcomes, and even determine action thresholds to begin implementing intervention. And two interventions that could be put into place would be genetic testing and the use of machine learning methods. Genetic information is thought to play a role in many common diseases, including cancer, diabetes, and cardiovascular diseases. And when combined with computational approaches, it can place patients into subgroups based on similarities that can be helpful in both diagnosis and treatment recommendations. Here is a list of some of my references, and thank you for watching my presentation.